Prudent healthcare needs prudent patients. So we're talking here about a new bargain between the user of the service and the provider of the service, in which we need patients who are both more inquisitive, both more willing to ask questions, more willing to explore the options that are available to them, and we need clinicians who regard the contribution that patients make in their own understanding of their own lives and the choices that they may want to make in their own lives. We need clinicians who listen attentively to that information and are prepared to act on it. For patients, it does mean that sometimes believing that an encounter with a health professional is one in which you hand the problem over to the worker and say, well, there it is, what are you going to do about it? That can't be the nature of the conversation in the future. The conversation has to be one about what are we going to do about it? What can the patient bring to the table? What does the clinician bring to the table? And how, by melding those two things together, do you reach a decision that is right for the patient? And there is very good evidence, the King's Fund particularly have published this in recent years, that shows that when patients have the different options explained to them, when they have the consequences of different courses of actions set out for them, they are very often likely to choose less intrusive, less invasive forms of treatment than simply wanting to rush always to have more done. And given that a second and important principle of prudent healthcare, over and above avoiding harm, is that we should always begin with the most basic, the most proven, the least intrusive forms of treatment, I think we will find that patients are allies in that regard once we have the sort of conversations I've just described with them.